Expedia and Visit Scotland invite you to come step into centuries of history that await in Scotland. Castles steeped in legend, walk along cobblestone streets. Come share the warmth of stories passed down through generations. This is a place with a past that is fully present today and all yours to explore. Plan your Scottish escape today at expedia.com/Visit Scotland.
You said this place was steps from the water.
We just haven't found the steps yet.
How much did we save?
Enough.
Enough to get lost?
Or you could book a stay with Hilton.
Welcome to your oceanfront room, just steps from the water.
The Hilton sale is on now. Book on Hilton.com or the Hilton app and save up to 20% to get the stay you expected. When you want savings, not surprises, it matters where you stay. Hilton, for the stay.
Hey everyone, Chris here from MedPrep to Go, and welcome to another episode of our USMLE Step 2 Questions podcast. In this episode, I'll be reading 3 more pediatrics questions from our online Qbank, and as always, you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Pediatrics 10. A 5-year-old boy is brought to the pediatrician with a 4-day history of high fever, cough, runny nose, and red eyes. His mother reports that he developed a rash yesterday that started on his face and has now spread to his neck and trunk. Past medical history is negative and he does not take any medications. He has not had any recent travel or known contacts with anyone who has been ill. Vital signs show a temperature of 38.9 degrees Celsius or 102 degrees Fahrenheit, but are otherwise within normal limits. On physical examination, the child appears ill and a maculopapular rash is noted on his face, neck, and trunk. Upon inspection of the oral cavity, small white spots are observed on the buccal mucosa. Which of the following is the most likely diagnosis? Is it A, chickenpox, B, hand, foot, and mouth disease, C, measles, D, rubella, or E, scarlet fever? And the correct answer is C, measles. Measles presents with high fever, cough, rhinorrhea, and conjunctivitis, followed by a maculopapular rash beginning on the head and neck, which spreads downward to cover the trunk. Koplik spots, which are white spots on the buccal mucosa, may be seen 3 days after the onset of symptoms. The clinical presentation and the presence of Koplik spots in this child are characteristic of measles. Answer choice A, chickenpox, is incorrect. Chickenpox presents with a vesicular rash that appears in crops and is typically associated with mild fever and malaise. Answer choice B, hand, foot, and mouth disease, is incorrect. Hand, foot, and mouth disease presents with oral ulcers and a vesicular rash on the hands and feet, not a maculopapular rash spreading from the head and neck. Answer choice D, rubella, is incorrect. Rubella presents with a similar rash, but is usually associated with milder symptoms and does not have Koplik spots. Answer choice E, scarlet fever, is incorrect. Scarlet fever presents with a sandpaper-like rash and is associated with a sore throat and strawberry tongue, not Koplik spots. Key learning point. Measles presents with high fever, cough, rhinorrhea, and conjunctivitis, followed by a maculopapular rash beginning on the head and neck, which spread downward to cover the trunk. Koplik spots, which are white spots on the buccal mucosa, may be seen 3 days after the onset of symptoms. Question 2, Pediatrics 11. A 15-month-old girl is brought to the family physician by her parents due to a sudden onset of high fever reaching 104 degrees Fahrenheit or 40 degrees Celsius for the past 4 days. The parents report that the child has been irritable but otherwise appears well, with no signs of respiratory or gastrointestinal illness. She has not been pulling on her ears. She has been taking fluids well and urinating normally. Today, the fever resolved abruptly and a rash appeared on her chest and abdomen. Past medical history is negative and she received all age-appropriate immunizations. The child is afebrile with normal vital signs. On physical examination, there is a diffuse macular rash on her trunk. The tympanic membranes are normal and the oropharynx is unremarkable with moist mucous membranes. Examination of the heart and lungs is unremarkable. Which of the following is the most likely diagnosis? Is it A, chickenpox, B, fifth disease, erythema infectiosum, C. Measles, D. Roseola infantum, or E. Rubella? And the correct answer is D. Roseola infantum. Roseola infantum is a common viral infection in young children, typically under 3 years of age. It is typically caused by human herpes virus 6, HHV6, and occasionally by HHV7. The disease often begins with a sudden high fever, which can reach up to 104 degrees Fahrenheit or 40 degrees Celsius, and lasts for about 3 to 5 days. During this febrile period, children may appear irritable but generally do not exhibit other symptoms of illness. As the fever subsides, a rash appears. The rash associated with roseola is macular or maculopapular and typically starts on the trunk, spreading to the neck and other extremities. It is usually not itchy and fades within a few days. The diagnosis of roseola is primarily clinical, based on the characteristic pattern of high fever followed by rash. Laboratory tests are generally not required. While roseola is usually benign, the higher fever can sometimes lead to febrile seizures, which are the most common complication. Treatment for roseola is supportive, focusing on managing fever and ensuring adequate hydration. Antipyretics like acetaminophen or ibuprofen can be used to reduce fever. Answer choice A, chickenpox, is incorrect. Chickenpox presents with a vesicular rash that appears in crops, not a sudden rash following fever resolution. Answer choice B, fifth disease, erythema infectiosum, is incorrect. Fifth disease presents with a slapped cheek rash and a lacy reticular rash on the body, not the pattern seen in roseola. Answer choice C, measles, is incorrect. Measles presents with a rash that begins on the face and spreads downward along with Koplik spots, not the pattern seen in roseola. Answer choice E, rubella, is incorrect. Rubella presents with a rash that begins on the face and spreads downward and is usually associated with mild symptoms, not the high fever seen in roseola. Key learning point. Roseola infantum typically presents in a child under 3 years with a classic progression of high fever with no apparent cause for approximately 3 to 5 days, followed by an abrupt return to normal temperature just as a diffuse macular or maculopapular rash appears on the chest or abdomen. Roseola infantum is caused by human herpes virus type 6. The diagnosis is clinical and treatment is supportive.
Some things happen fast, like a vacuum finding your lost earring. A dog reacting to the word walk. And settling up with friends on the PayPal app. Send and receive money in seconds. Access your balance to send, shop, pay bills, and more. Download the PayPal app to get started. An account with PayPal is required to send and receive money. A PayPal balance account is required to hold and use a balance.
Bonjour, compadre. It's the
Priceline Negotiator.
How do I negotiate so many great travel deals? My greatest gadget, the Priceline app. It's got hotel deals, flight deals, rental car deals, all of those deals in a bundle. Deals, game day deals, concert trip deals. No one deals more deals than Priceline. Hold your horses, there's more. The app lets you filter hotels by neighborhood, vibe, star level, and amenities like pools and spas and beachfronts and... Wait, I'm not done. Stop cutting me off.
Priceline.
Question 3, Pediatrics 12. A 2-year-old boy is brought to the emergency department by his parents due to difficulty breathing. The parents report that the child had a runny nose and a mild cough for the past 2 days. This evening, he woke up with a harsh barking cough and high-pitched sound when breathing in. His temperature is 38.2 degrees Celsius or 100.8 degrees Fahrenheit, blood pressure is 90/60, pulse is 130 beats per minute, and respirations are 32 per minute. On physical examination, the child is awake and alert but appears anxious. He has audible inspiratory stridor while sitting quietly on his mother's lap. There is no drooling, and he is able to swallow water without difficulty. Lung auscultation reveals clear breath sounds bilaterally with referred upper airway noise. There are mild subcostal and intercostal retractions. Which of the following is the most appropriate next step in the management of this patient? Is it A, administration of intramuscular epinephrine, B, administration of nebulized racemic epinephrine, C, lateral neck radiograph, D. Oral amoxicillin, or E. Urgent endotracheal intubation? And the correct answer is B. Administration of nebulized racemic epinephrine. This patient is presenting with a moderate case of croup, also known as laryngotracheobronchitis. Croup is characterized by a prodrome of upper respiratory infection symptoms, followed by the classic barking cough and inspiratory stridor due to subglottic edema. The management of croup depends on the severity of the symptoms. Patients with stridor at rest, as seen in this child, are classified as having moderate to severe croup. The most appropriate next step for a patient with stridor at rest is the administration of nebulized racemic epinephrine. Epinephrine acts as an alpha-1 agonist to constrict the precapillary arterioles in the upper airway mucosa, which rapidly reduce subglottic edema and relieves the airway obstruction. This should be given in conjunction with corticosteroids such as dexamethasone to provide a longer-lasting anti-inflammatory effect. Answer choice A, administration of intramuscular epinephrine, is incorrect. Intramuscular epinephrine is the first-line treatment for anaphylaxis, which can cause laryngoedema and stridor. However, anaphylaxis typically presents with an acute trigger, urticaria, and often hypotension or wheezing. In a child with a 2-day viral prodrome and a barking cough, croup is the much more likely diagnosis, and nebulized epinephrine is the preferred route for local airway effect. Answer choice C, lateral neck radiograph, is incorrect. A lateral neck radiograph is used to look for the thumbprint sign associated with epiglottitis or to evaluate for a retropharyngeal abscess. This patient does not have the high fever, drooling, or muffled voice characteristic of epiglottitis. In croup, the diagnosis is clinical and imaging is usually not necessary unless the diagnosis is in doubt or the patient fails to respond to standard therapy. Answer choice D, oral amoxicillin, is incorrect. Croup is caused by viruses such as parainfluenza virus, respiratory syncytial virus, influenza, or adenovirus. Because of this viral etiology, antibiotics are not part of the management of croup. Answer choice E, urgent endotracheal intubation, is incorrect. Intubation is reserved for patients with impending respiratory failure who do not respond to nebulized epinephrine and corticosteroids. Signs of respiratory failure include fatigue, decreased mental status, and worsening hypoxia. This patient is currently alert and has only mild retractions, making medical management the appropriate first step. Key learning point: the management of croup is based on clinical severity. All patients should receive a single dose of corticosteroids, typically dexamethasone. Patients with stridor at rest or significant respiratory distress require the addition of nebulized racemic epinephrine for rapid reduction of subglottic edema. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on Facebook, LinkedIn, Instagram, and YouTube to stay up to date with our content. And of course, you can learn more and read other Step 2 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We would greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com.